There we go. Good afternoon, everyone, and good day to the folks on the West Coast. I'm Bob Blancato, an Executive Director of NANASP. I want to thank you for joining us for our webinar, Navigating Open Enrollment and Changes to Medicare Part D. I want to first introduce the speakers, as Neil introduced them again when it's their turn, but Adina Lasser is Director of Public Policy and Government Relations at the Alliance for Aging Research, an organization that NANASP works very closely with. Melinda Forstey is our Board Chair and President of NANASP and President and CEO of Serving Seniors of San Diego. And Kimberly Strong, Executive Director of Cabarrus Meals on Wheels, and another NANASP board member. We appreciate all of you joining us today. We're now into the second week of open enrollment, and we're going to go first with the agenda to tell you what we're going to cover today. We're going to do an open enrollment overview, followed by a Part D overview with 2026 changes to Part D, then the prescription payment plan. Now that'll be followed by a roundtable discussion, sharing updates with senior clients, and then we'll close with enrollment tools and resources. I'll give that a second so everybody can see what the agenda is. And then let me go now to the basics of Medicare, or we call the alphabet soup of Medicare. First of all, Medicare Part A is the hospital insurance inpatient program for paying inpatient hospital stays, skilled nursing home care, hospice care, and some home health services. Medicare Part B is the medical insurance side, which covers outpatient services such as doctor visits, laboratory tests, x-rays, durable medical equipment, and ambulance services. Part C is Medicare Advantage, which many people have heard about and probably discussed today. These are private health plans approved by Medicare that offer all of Part A and Part B benefits, but they also may offer additional supplemental coverage like dental, vision, prescription drugs, and in some cases, nutrition services as supplemental services, as they're called. And Part D, prescription drugs, helps pay for the brand name and generic drugs you need. It's optional and offered to everyone with Medicare by insurance companies and other private companies approved by Medicare. So that gives you the framework of Medicare, okay? And then let's go next to what is Medicare Open Enrollment, okay, which, as I mentioned, began on the 15th of October, and will go right now through December 7th. It's normally the same time period every year. And during this time, older adults can sign up for original Medicare or Medicare Advantage, switch from original Medicare to Medicare Advantage or vice versa, replace your Medicare Advantage plan with a different one, and also select a Part D plan. Now, the next slide, something that we should all make sure we follow and pass on to those who may not be on the webinar, telling people don't skip open enrollment, okay? Sometimes people stick with a plan or get stuck with a plan, depending on your context, that they signed up for years ago because they think it's too much trouble, they don't want to go through it, they don't want to study the differences, etc. But you got to realize, particularly for those who signed up years ago, your plan may not work the same as when you first enrolled. Medications, for example, that you take may not be covered anymore, or they may cost a lot more now than when you enrolled. Your doctors or pharmacies might not be in the network like they were before. And what was a great deal years ago could be costing you hundreds of thousands of dollars extra today than they were when you signed up. So it's very important to emphasize this point. Make sure you study and take advantage of open enrollment and don't skip it, especially if you have been on a plan for a number of years. Next slide talks about what participants should have received, and would be curious in the chat if folks have not received this, and we'd like to know so we can help facilitate that. It's called the Annual Notice of Change. It should have been received in the mail during September. It is sent to everyone with Part D or Medicare Advantage plans. It shows you exactly how your cost and coverage will be different in 2026, including if your plan is being discontinued entirely, if changes to premiums and deductions, covered medications, pharmacy networks, and doctor hospital networks. If there's changes to any of those, that would have been in that notice. And then some changes could have mean better coverage, others could mean higher cost. The bottom line is that your 2026 plan will not be identical to your 2025 plan. And the key updates are in the first few pages of this annual notice of change. It takes about 30 minutes to read, but it could cost you a lot of money or save you a lot of money, depending on how you proceed after you read it. So it's very important. And with that, I am now happy to, Adina Lasser will join us from the Alliance for Aging Research, their Director of Public Policy and Government Relations. And welcome, Adina, and thank you so much for joining us today.
Hi, Bob. Thank you so much. Thank you for having me. I really appreciate both you and NANASP including the Alliance on this webinar. My name is Adina Lasser, and I'm the Director of Public Policy and Government Relations at the Alliance for Aging Research. As Bob said, we work really closely with this organization, and we are a patient advocacy org. Our mission is dedicated to changing the narrative to improve healthy aging and ensure equitable access to care. And I'm very glad to be here with all of you today. Um, so Part D is amazing. Thank you. Yeah, you can actually go to the next slide. Appreciate it. Medicare Part D was created in 1965 and it's celebrating its 60th anniversary this year. It's an incredibly important program for all of our nation's older adults and also anyone who has a disability. It's an optional drug insurance benefit that covers anything that has to do where you get your prescription at the pharmacy counter. So for example, if you have to go to a hospital or an infusion center, that's going to be under a different sort of part of Medicare. But if you're going to the pharmacy counter, this is kind of what we're talking about today. And during open enrollment, you can make changes to your Medicare Part D plan, and that runs from October 15th, so it's already started, all the way to December 7th. Next slide. There are big changes coming in 2026, and I really want to emphasize what Bob has already so eloquently said about this is not the year to just let your coverage continue on. And I'm going to get into a number of reasons why. The biggest one is that premiums are expected to increase. And so you might be seeing headlines that premiums are steady or they are, on average staying the same. There's a lot of discrepancy about that, but for the average person, just because premiums tend to be staying the same or decreasing or increasing, and it really depends on whose numbers you're using, that doesn't mean that your plan is going to be staying the same. So it's important to make sure that your plan, the numbers are not, your premiums aren't going up. I've seen premiums going up as much as $50 a month. So it can be a really impactful amount of coverage. Overall, the choice of plans is also shrinking. There are fewer plans in the program, fewer Part D plans, fewer Medicare Advantage plans, which are some of those plans that have the supplemental benefits that you see, like hearing and vision coverage. And so all of these, there's just a number of factors at play. Obviously, there's political climates at play that make it really important that this is the year to not let your coverage just roll over. Next slide, please. So as you shop for Part D coverage, what are some things that you want to make sure that you're considering? First of all, is this coverage still fitting your needs? Is it still in the amount of money that you want to pay? Is it still covering the drugs that you need? For example, one thing that can change and one thing that we're seeing more and more of is plans using increased utilization management. So that means things like you need to try and fail on a cheaper therapy before we'll give you this drug, or we need a prior authorization from your physician before you're able to access the drug that you're currently on. There's also an increase in the amount of coinsurance that's being used, meaning that the average beneficiary, when they go to the pharmacy counter, is responsible for a higher level of their costs versus when they just had a relatively cheap copayment in the past. Those are all things to be looking out for as you shop for your next plan. Next slide, please. Awesome. Now I want to talk a little bit about why that's happening and why these changes are taking place. And this is all has to do with a law that was passed in 2022 called the Inflation Reduction Act. There's many provisions of the Inflation Reduction Act that have to do with Medicare Part D, and some of them you've probably already heard of and are probably already seeing in your own coverage. The first is that $35 cap on insulin, which means that it's much more accessible to get insulin out of pocket. So that's fantastic. That went into effect in 2023. Same with vaccines. So vaccine cost sharing has been entirely eliminated, meaning that if a vaccine is recommended by the ACIP, which is a kind of advisory committee within the CDC, as long as they say that it's okay for an older adult to have a vaccine and they recommend it, you can get that vaccine with no cost sharing. So really wonderful public health improvement. Then there's an expansion of what's called the LIS, or the low income subsidy, meaning that if you are within up to 150% of the federal poverty level, you are now eligible to be part of that low income subsidy program. And all of those have been in effect for a couple of years now. And then the last two, actually, if we can go to the next slide, I'll get into them there. So the out-of-pocket cap is something that went into effect in 2025. It is indexed with inflation, meaning that you're not going to spend more than, this year it was $2,000 on your out-of-pocket expenses. Next year it's going to be $2,100. And it's adjusted, like I said, annually. You don't have to enroll. It's an automatic thing. And so your general out-of-pocket expenses for any of those covered prescription drugs is not going to be more than $2,100. While that's still a lot of money, it's definitely an improvement over the no cap that used to exist. So we're really excited about that provision in the IRA. The other one, which is a little bit more complex, is the Medicare Prescription Payment Plan. You might have heard of it as smoothing. And these two work in conjunction together really nicely because the cap says you're not going to spend more than $2,100. The Medicare Prescription Payment Plan, or MP3 as we've been calling it, says that, okay, if you're going to have that level, which is still a significant amount of money for many older adults, we are going to make it so that you can spread out those payments over the course of the year before you hit that $2,100 so that you're not having to pay all of those costs up front. And Laura, if you could go to the next slide. And those are interest-free payments, so that's really great. The Medicare Prescription Payment Plan won't benefit everybody, but it'll benefit a lot of people. So generally, if you are someone who faces higher drug costs, or you've noticed that you have a high deductible and you're hitting it in January every year and you're really feeling that hurt, this program is designed for you. It likely won't benefit anyone in the list or the Medicare Savings Program. If you don't have, high drug costs, there's probably not a need to spread out your medication costs over the course of the year. But for the people that it benefits, it makes a huge difference. Enrolling for this can be a little bit complicated, and we're actually trying to work with Congress to make it more simple. And I also want to plug, and I think this is on a later slide as well, that the Alliance for Aging Research has come up with a number of resources, specifically a 3-minute video that talks a little bit more about this program and gives you the information about how you can enroll and what it really means to enroll. But there's many ways to do so. Your telephone, your paper, your online, you're automatically re-enrolled every year. So if you're on it this year and you like it, you're good to go. If you are not on it this year and you'd like to be, it's time to add it. And if you have not benefited from it and want to come off of it, that is something that you're going to have to tell your plan. All right, couple more changes to Part D. There is going to be CMS is now, or Medicare is now negotiating the cost of the 10 prescription drugs with the manufacturers, meaning that the costs to the program are going to be going down, and these drugs are hopefully going to be a little bit more available to people because there's a requirement that they put them on the formulary. So it'll be interesting to see if your medications are on the negotiated list or not. One thing to check, this is just another plug for checking to make sure that your coverage is still right for you. Even if it's being negotiated and it's still required to be on a formulary, that doesn't mean it's required to be on a certain tier of your formulary. So you could still face cost sharing, utilization management, like that step therapy I was talking about, or having to get a prior authorization from your physician. So it's important to make sure that even if it's being negotiated, which, there's all kinds of benefits to um, just making sure that you have the right coverage for you. And I think those are all my slides.
Okay. Thank you,
Thank
Adina,
you, Bob.
thank you very much for your presentation and your information. And I should mention, in addition to, I'm getting a sign. I thought I hit I'm getting all these signs as I'm trying to do my work here. Okay. In addition to her work with the Alliance for Aging Research, I should point out that she also was the advocacy coordinator at the American Neurological Association and was an intern at the White House Council of Economic Advisors. So, Adina, thank you again for your presentation. Now, we're going to move to our roundtable discussion on educating older adult clients on health policy changes. And this will be led by first Melinda Forstey. Let me give a little deeper introduction, who's president and CEO of Serving Seniors, a San Diego nonprofit supporting low-income older adults and addressing homelessness. She is the board chair of NANASP, as I mentioned. She also serves on the Disability and Aging Community Living Advisory Committees, which provide strategic direction for the California Master Plan on Aging. For those of you who have followed master plans, that was the first in the nation and the model that many states are following. She'll be joined by Kimberly Strong, Executive Director of Cabarrus Meals on Wheels in Concord, North Carolina, where she has launched initiatives to combat hunger and isolation. She's the immediate past president of Meals on Wheels in North Carolina and a new board member of NANASP. She also founded Strong Ops Nonprofit Solutions, LLC, helping organizations strengthen operations and achieve greater impact. So with that, I guess I'll turn it to Melinda first.
Great. Well, thanks, Bob. And thank you, everyone, for joining us today. As Bob noted, I'm president and CEO of Serving Seniors. Just a quick overview of our organization. We provide meals, housing, and wraparound services to older adults throughout San Diego County. And we are really focused on those most in need. So the majority of the seniors we serve are living below the federal poverty level. Many live alone, do not have familial support. And so that's where Serving Seniors comes in and is really able to provide them with those wraparound services. So one of the things that Serving Seniors does, we do have a team of case managers and health educators. But over the years, we've been fortunate to have about 25 collaborative partners on site at our main flagship location, which is located in downtown San Diego. Really, one of our approaches is to collaborate with partners that are subject matter experts. And we've had a long time relationship with our Legal Aid Society of San Diego. And they have a specific team dedicated to health. They're called the Consumer Center for Health Education and Advocacy. So this team is embedded right in our senior center. Their office is actually right in the dining room. And they partner with our staff and our clients on a whole array of health education and advocacy. So some of the key things that the Consumer Center does is they regularly make presentations at mealtimes where we have hundreds of older adults each day. And so in addition to changes with Medicare, they're also well-versed in any updates on Medi-Cal and other supportive services. During these presentations, there's an opportunity for Q&A, and we do serve a very diverse population. And so we also ensure that our staff is able to translate these trainings in the primary languages of those clients that we serve, along with having materials translated in all of those major languages. In addition to the presentations during the lunch hour, they also make periodic announcements at mealtimes to remind seniors that they're available for one-on-one appointments. We distribute flyers throughout the building, not just at our wellness center, but also at all of our senior congregate sites, and also to our homebound clients who are receiving meals. And so they are able to provide telephonic support as well. An additional way they're able to provide education is that we do have a cyber cafe on site, which they also staff. And so they're also able to go right next to the person as they're navigating, through the CMS website, perhaps as they're looking, at their list of medications, or, if they feel comfortable sharing, information in their health portal, if they've granted that information and permission to the team. And then in addition to really having this hands-on approach directly with our clients, the Consumer Center has been a fantastic partner with the rest of our case management and health education team. So they meet each week with our team and really have a collaborative case conference approach where if there's one client that may be seen by serving seniors, but it's also having some challenges navigating any changes with Medicare or Medi-Cal, they're able to talk that through with our entire team. So we really are all on the same page. Everyone is aligned in terms of, what work each person is doing, and then what additional action steps may be needed. And I did want to share, just a quick story just about how important having this hands-on approach really is. So recently, one of our clients who is visually impaired contacted the Consumer Center after his pharmacy told him that his plan had rejected coverage for his stage 4 cancer medication. So the Consumer Center reached out to the Cancer Treatment Center, and essentially what they learned was that it was a coding issue. And so they were able to step in to, an older adult who really needed that additional assistance, reach out to the treatment center, to his plan, and ensure that they were able to correct those coding changes and that he was able to receive this life-saving medication. So with that, I'm going to turn it over to Kimberly. I know there'll be more time for some Q&A, but wanted to share that example of a fantastic partnership that has really worked well for serving seniors.
Thank you, Melinda. Kimberly?
Thank you, Melinda. Thank you, Bob. As Melinda and Bob have said, I am Kimberly Strong. I'm Executive Director of Cabarrus Meals on Wheels here in North Carolina. We are located just north of Charlotte. We are their neighbors. We are just a home delivered meal program. So we don't have all the wraparound services, but we are home delivered meals of over 500 meals every day. And so we disseminate information through a little bit different means than being able to do it at a congregate setting or face-to-face. So it's important that, our clients get trusted information, health information. So they get it, they come to us, as everyone knows, we get calls for everything. So on our delivery routes, we are able to get out some vaccination information. We give nutrition education, dietary guidelines. We do health insurance and benefits through our SHIP program here in North Carolina, the Senior Health Insurance Information Program. So we are doing, during COVID, we had a great partnership with our Cabarrus Health Alliance and Cabarrus County EMS, and they came to us. We were trying to figure out a way homebound clients could get their COVID vaccinations through trusted means, get trusted information about the vaccinations, and we had this partnership. So at that time, over 120 of our seniors received vaccinations without leaving their homes. Cabarrus County and the nurses at Cabarrus Health Alliance would go into their homes, give them their vaccination, first they did health information, and then they would give them their COVID vaccinations. And that was a great success. because they were the most vulnerable people. They were the ones who could not get out to the clinics. They got that trusted communication through, Meals on Wheels. They trust us. They know us. They were comfortable with us. So we were trying to reduce health disparities among older adults. So we served as that public conduit between health and social lifeline. And then throughout the year, we also give out information. We do printed inserts. We have great ship stickers that will be going out on all of our meals in the next couple of weeks, so people understand about open enrollment, tells them how to contact our senior health care. We do a monthly newsletter, and in that newsletter, we send out information, flu shots, vaccinations, nutrition, what food sources. Again, your clinics, your pharmacies, we stay connected and informed, and we try to make sure that our homebound clients who aren't always out there in the community are able to have that trusted connection with our program, knowing that they know us, that they can trust what we do for them. So those are some of the ideas and the ways that we here in Cabarrus County get that information out to our homebound clients. Again, it's just important to make sure that they have that trusted communication with us. So pass it back to Bob.
And we appreciate the comments that were just made, and we appreciate, and we're going to encourage people to send questions to the Q&A or through the chat, whatever you prefer. And Kimberly, I'll take this slide. It's a continuation of your work, and we love what you do with your continuous education. I'm particularly, and I know the Alliance for Aging Research and NANASP work very closely on the vaccine situation. We are determined to make sure that older adults know about the most up-to-date vaccines and have access to them. And we appreciate your help. So let's go to the next slide. And I am happy to talk about how we can spread the word. And these resources are probably the most important thing we can think about right now. And I actually put my video on too, okay? Because resources are very important to get the reliable information that you need. Medicare.gov has been updated with information on the Medicare prescription payment plan, and fact sheets on the plan are available online. CMS has made changes, some of which we encourage them to do along with the Alliance, to the Medicare Plan Finder tool, including an estimated monthly payment calculator. The CMS site on the payment plan is what's listed in boldface below. And then, of course, the Medicare Payment Plan Wizard. And these slides will be available, particularly these resource slides, for folks that have joined us today. And whatever the process is, whether you do webinars, lunch events, handouts, calls, outreach, the CMS resources should be included in any education activity that you do. And then next slide talks about our. Oh, Melinda, I'm going to turn this over to you for this slide, if you don't mind.
Sure. Yeah. Well, I thank you, Bob, and wanted to just say a big kudos to the NANASP team for putting some great materials on their website. So always want to put a plug in to visit the NANASP website. So as you can see here on the NANASP page, under the advocacy section, there's actually a health section, and it has a lot of very helpful information about Medicare Part D. It also includes one-page handouts available to print and distribute. And these handouts are on the Part D changes, prescription payment plan, and how to enroll. As you can see on the top of the slide, there's also amazing partner resources, such as from the Alliance for Aging Research And so that has some really great videos, infographics at the loweroutofpocketcost.org. And then MAPRX has an open enrollment guide, infographics, and scripts for call centers available on their website as well. And then really lastly, I would just really encourage all of our participants, to leverage your AAAs, to leverage your SHIPs, otherwise known as your state health insurance assistance programs. SHIP counselors are available in most counties to answer Medicare questions, but they're not licensed agents. But there's just, an array of great services out there. And also there may be some other collaborative partners in your community, such as Legal Aid that we found in San Diego, that might also be able to come down to your senior centers, or even work with some of your home delivered meal clients to provide that individual one-on-one support. So with that, I will turn it back over to you, Bob.
Thank you, Melinda, very much. And so go to the next slide, and we need to bring this into the conversation because it is becoming more prevalent in a concerning way, which is the problem of scams and how scammers do target seniors during open enrollment. And you need to be very vigilant during this open period about who you hear from that claims to be a knowledgeable person on Medicare. Medicare will never call you. The federal government never calls you unsolicited asking for your Medicare number or bank information. Okay. The red flags you should think about as a consumer, and for those of you who are caregivers, making sure that you're caring for older adults and also keeping them safe from scams. Look out for pressure to act immediately. People who come to you and want to act immediately should be a red flag immediately. Requests for payments via gift cards or wire transfers, that automatically should be a red flag. Okay. Legitimate Medicare agents should never ask for payment up front or review your plan options. They should never ask for payment, period. And the minute they do, again, there's your red flag. There's an old saying about be wary of offers that sound too good to be true because they are too good to be true. And we had this discussion yesterday about free medical equipment, which if you choose to the scammers don't care about the quality of the medical equipment they're offering you. It could be dangerous to you to have the wrong kind of braces or the wrong kind of wheelchairs. And anything offering extra benefits, be careful. Don't even entertain the thought. You need to report suspicious calls or activities to 1-800-MEDICARE or the Senior Medicare Patrol. And we're also happy at our NANASP website to get information as well from people. And help educate older adults that we work with, that we care for, about these warning signs. Because the scammers oftentimes are ahead of everybody else, and we need to be vigilant to protect our older adults from giving out information, from giving away money, anything of that kind. So please follow this advice carefully. And then I also want to talk next slide about where we are right now. Everyone is aware of the fact that we are in the 21st day of a government shutdown, and we want to talk about what in terms of the impact is. Now we know that the shutdown began October 1st. The good news in all this is that by all indications, and we check daily on this one, Medicare open enrollment continues as planned from October 15th to December 7th. We've gotten assurances that the Centers for Medicare and Medicaid Services have adequate staffing dedicated to the open enrollment period. Your Medicare benefits and coverage will continue. Okay, very important, just like your Social Security checks will continue. There's mandatory spending that's built into law. Now, there may be some delays in what goes on to the Medicare.gov website, okay? But the Plan Finder is already loaded with 2026 data. Now, you can expect some potential delays in customer service and some longer waiting times when you call 1-800-MEDICARE, okay? The processing of applications may be delayed if you're making changes during this period. we will monitor these open enrollment government resources and how the process is unfolding. We check daily around the country to see what kind of stories and people are sharing with us about any issues that older adults are facing in open enrollment. And if necessary, we will advocate for extending the December 7th deadline if there are delays caused by the shutdown in the front end of open enrollment. So we just want to know that we're monitoring the shutdown very closely as it relates to open enrollment, and will continue throughout until the shutdown ends. So with that, before I go, I want to ask if Melinda and Kimberly can come back on. I want to just ask a couple of questions that could enhance the presentation a little bit. So you talked about some great programs that both of you are doing, but what barriers do you see in getting the word out in this area? Linda?
Yeah, I think one of the largest barriers is particularly with our homebound clients. So even though we are passing out materials, sometimes just not having that face-to-face and being able to really walk someone through can be challenging. I also think just navigating through all of the information, and also in particular, we're fortunate enough that we do have case managers that speak the main languages of the older adults we serve. But I do know that is also another huge barrier. And then lastly, I would add, to the example I provided with one of our clients who was visually impaired, had no family, but was luckily already connected to our senior center. If he was not connected, there's a real chance he would have lost coverage of his cancer treatment, even though it was simply a coding error. So I think it's really important to get the word out there, whether it's a resource that your organization can provide, or referring, your clients and the older adults you serve to other resources that are available. And there can never be too much education.
Thank you for that. Kimberly, any thoughts on that?
I would just say, I think a lot of it is that they get too much information, they're overwhelmed, and they're not sure exactly what is factual and what is not reliable. I was just visiting my mom last week. She had been in the hospital, and I was in Rochester and with her. And it's every day. There's things in the mail. There are people calling. All of this. There's Medicare enrollment, blah, 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 and it's overwhelming for all of our seniors. And I think that is a big barrier to making sure that they know what and who to trust.
And I think that last point is very important, because if there's one thing that the Aging Network has, is a reputation of being trustworthy. Okay, older adults trust who they talk to in the senior center, in the area agency, in the home delivery meal program. And this is probably one of those times when that trust becomes more important, when there's a lot of noise going on in other places that relate to people who are not trustworthy. And the inundation problem of materials that are coming out. And that's why, it's very important to be, to be patient on the part of older adults and their families during open enrollment, to make sure that they're not pursuing, what looks like a quick solution, which turns out to be problematic. We're going to stress on this webinar that the Aging Network, in every community that's represented on this webinar and among our members, is the place to go to get the information that you need to get us through open enrollment and making the right decisions. So in your judgment, Kimberly, I'll start with you and then I'll ask Melinda, what are some of the creative ways? We have to be creative in everything we do sometimes. What's the creative ways to get the word out? And do you find that in-person or print education to be more helpful, or is there some combination of it?
As Melinda had said, that in person, you really can't beat the in-person, but when you're doing home delivered meals, that's not possible with over 500 people every day. So we do a lot of printed materials. We make sure we get all of that information from sources that we trust. We get that out. Again, we're doing the stickers for ship to make sure that people understand that'll be on all of their meals so that they can see that. Again, it'll go out in our newsletter, letting them know if they have questions, they can call us too. Just making sure that they know that we are in this or trusted partner in this process, and that they can call us for trusted and reliable communication.
Thank you, Melinda.
Yeah, I think we kind of pack it from all angles, right? So the in-person, the printed materials, and even with our social media presence as well. So we'll try and get the word out there to the greater community at large, pointing them to resources, even if they may not necessarily be a current client of ours. We also, we'll do print media. We'll do TV, radio. So it really is trying to attack it from all angles. And then also what we've also started to do is to have set times where our team at the consumer center is available. So people know that they have availability between these specific times. So that helps ease the appointment process for that one-on-one support if they do need it.
Great. And you were nice enough to give a shout out before to the NANASP staff, and I join you with Laura and Chloe. But let's do another shout out, more local in nature. Who gets involved at your organization in educating participants, whether it's on vaccines or Medicare Open Enrollment? Who do you want to shout out that does such a good work job? Melinda, I'll start with you.
Yeah. So I would say, our AAA has been fantastic to work with. They have a group called Champions for Health, and we've partnered with them to do vaccine clinics at all of our sites. We've also partnered with local healthcare organizations on vaccine clinics. And then also wanted to shout out the Serving Seniors team as well. We have fantastic case managers and health educators. And if they're not able to resolve an issue with a client, then they will connect them with one of our partners to make sure that we're addressing all of their needs.
That's great. Kimberly?
Very similar. Our our central line of AAA has done a great job always getting that information out. Our partnership with our local health alliance, as we do vaccine clinics, we do health information fairs with them. We get that information out. And again, just our case managers here.
I'm just curious. I mean, because open enrollment just started, and because we're in this sort of challenging environment, and people are aware of there being a lot of changes. Are you hearing more chatter about open enrollment this year than previous years? Kimberly, I'll start with you.
Not necessarily. Again, we've had some calls from people just not exactly sure what is going on, especially with the government shutdown, asking about, is it still doing it? What am I supposed to do? Is it going to happen? Do I stay the same because no one's there? And so we've had a little bit of that, but I don't think it's much more than what we typically do.
Okay. Melinda?
So for the majority of our older adults that we serve are Medi-Medi, so they're on Medicare and Medicaid. So there has been a lot more chatter just around that in general. So some more chatter around Medicare Part D, but it's really what are going to be the impacts, particularly with the proposed changes around Medicaid.
Mm-hmm. Yeah, I imagine that would be, and that's going to continue, as we know, because these changes are rolling out over a longer period of time. I believe this is for Kimberly. We have a question in the chat. Where can I get those ship stickers for our people?
So I've got them from our North Carolina SHIP program. I saw them last week and they gave them out to me. They had a lot of them. So I would contact either your local office or the North Carolina main office.
Okay, good. And there's, I'm not sure if Jan, I'm not sure where you're from, but there's probably a ship program in your area that you could get the same stickers to, and that's a very important thing to have. Let me think if there's anything else. I guess this is an obvious question, but I'll ask it anyway. Which are the communities that you serve, are they receptive to education programs and education initiatives like you've been talking about? Kimberly?
Yes and no. Better now, obviously COVID was so controversial, and vaccinations now are controversial. We've seen good and bad with that. The community as a whole is receptive of health information, vaccine information, and so forth. Some of our clients, we've had some discussions on how we are trying to make them take poison into their bodies and so forth. And we go back to, I think, again, where they're just inundated with so much information and what they choose to watch and read. And so I would say overall, yes, but there are some that are not receptive.
Yeah, okay. Melinda?
Well, yeah, I would just underscore Kimberly's earlier point about the importance of trust. So we have really been able to build that trust with our clients over the years. So I would say overall, they are very receptive. Of course, there's on a case-by-case basis. I also think because the majority of the seniors that we serve really do not have familial support, that they really do come to us for that education and for that assistance with navigating.
Yeah, that's very helpful to know. One of the things that we're going to do as a result of this webinar and our ongoing activity in this space is, have some questions for CMS to try and respond to. And I'm going to give you some of what they are. What is working for older adults in the eyes of CMS? Okay. What feedback are they getting on the prescription payment program and the overall sign-up process? And then, what changes they need to make in the future? And I think it's a combination of a sort of a public-private partnership. We're going to get input from around the country about what's happening in open enrollment and share it with CMS to see if we can make improvements. We have noticed in the past, and the Alliance knows this as well, that we have been able to make changes to Medicare Plan Finder and even the Welcome to Medicare booklet in certain areas. But it can only happen if we get good feedback from our folks in the field. All right, I'm going to open it up to another question. I'm the Aging Population Program Assistant at the Martin County Library System, and I host the SHINE program presenters through the OEP. Is that a question? Let me see. That's a fact. All right. So I think someone's just sharing that they are in that role, the Aging Population Program Assistant. And so that's interesting. I'm curious about does either of you interact with your library systems? Are they at all involved in education programs for older adults in either San Diego or in Concord?
Serving seniors, actually, we have not partnered with our library system, but that's a great idea to see, what educational opportunities they may be offering.
Yeah.
Yeah, and I agree. We have not either, but that would be a great outlet to use.
And I guess, a question for each of you, what more would help you or your clients during Medicare open enrollment? What do you find to be most helpful? Is there more information? Is there just we have enough and we can just go from there? What's your sense at this early juncture in open enrollment? And I would add to that, we'd love to get feedback as you continue to interact with your older adults on open enrollment to see what's working for them. But anything that jumps to mind that we could do more of, or CMS could do more of?
I think really for us, it goes back to just having that one-on-one approach and having a human help them navigate. That's really been the most beneficial and impactful for the older adults we serve. Materials are very helpful, but to your point earlier, Bob, it can take 30 minutes to sift through. There's a lot of things to consider. So education is helpful, but continuing to make it as simple to read through is always a benefit.
Wonderful. Kimberly, anything?
I was going to add, a simple handout for them that they can understand. And again, that one-on-one, as Melinda said, that personal touch. When you make a phone call, you actually get a person to discuss what you need to and ask your question. That's very important. And
another question, can you share how you approached your area agency on aging to partner sharing Medicare OEP? That's a question from one of our participants. Anybody talk about your relationship with your AAA in partnering on open enrollment? I think, Melinda, you talked about your area agency, right?
Yeah.
You're pretty involved with them.
We are, yeah, and we partner with them on a variety of things. Like I mentioned, the vaccine clinics, they've done health education. I think because we've been fortunate to have this one partner that is on site 5 days a week, the Consumer Center, which is part of legal aid, that we've really relied on them heavily during the open enrollment process. But again, I mean, we're constantly partnering with our AAA on a variety of health measures, and they've been very, very receptive and helpful.
That's great. That's great. Okay.
And it's the same with us too. We partner with our AAAs with everything. We have a great relationship with our AAAs, and they're always just out in the community and offering different programs and ways to partner.
Right. Right. And I think everybody learned that partnership thing during the pandemic, when all of our programs in the aging space sort of turned on their head a little bit. And, you know, without a playbook, everybody in that network did such a fabulous job of addressing things. Did the AAA accept your to be able to display flyers and things like that? Is that something that they would support? That's a question from the audience.
Oh, yes. Yeah, absolutely.
Mm-hmm. Absolutely.
All right. And see, we've done such a good job. Now our question is going to say, I will now stop by my local AAA. That's good. That's what we wanted you to come out of this conversation with. So, so we have another slide we want to just keep up now as we come to the end of this webinar, which is, you know, action items before open enrollment ends. Okay. Go back and read that annual notice of change from your current insurer, which you should have by now. Compare your current plan against other available options. Check if your doctors and pharmacies are still in network. Okay, very important. Verify your medications are still covered at reasonable costs, and particularly if they're being under the negotiations that we talked about earlier. And don't assume last year's plan or a plan you signed up for maybe 2 or 3 years ago is still your best choice. Okay, you know, an educated consumer is key to this whole thing, and those who can guide those individuals, older adults and so on, are very important as well. And so I will say this, I'm going to ask Adina, Melinda, and Kimberly if they have any closing comments. I'll start with Adina if you're still with us. Anything you want to add before we close out?
No, first of all, I just really appreciate everything that Melinda and Kimberly have said and everything that NANASP is doing for, you know, older adults and getting the word out there, specifically the SHIP program shout out. I just want to echo that. They're so knowledgeable and they're so willing to help, and that's their whole job. So I just wanted to echo that. I also wanted Bob to add to what you were saying about, you know, we still need more information from CMS, especially around the Medicare prescription payment plan. It would be really helpful if CMS would share with us things like how many people have already enrolled, how that enrollment is going, what kind of questions they're getting from beneficiaries that could benefit. And that way we can help to amplify their message and serve as that kind of trusted partner. And so we've been doing some work on the Hill, trying to get them to encourage CMS to work with us on that. And we've had a couple of meetings with them. But I think, you know, it's always great to hear from the actual constituents and beneficiaries who stand to benefit from that information. So I just wanted to plug that a little bit because it's something where people need more information and we want to give it to them. And we just need some, like you said, public-private partnership to make that happen. And thank you so much for having me today.
Thank you for joining us. We appreciate it. Melinda?
Yeah, I would just like to add, you know, I know we all are doing a million things, right? We're all very busy getting our meals out and providing other services. So really do encourage everyone to look within your community at what other partners you can collaborate with. In addition to your AAA, there's lots of great nonprofits and other organizations out there doing great work that may be able to fill in the gaps for your team and for the older adults that you're serving.
Wonderful. And Kimberly?
I would say just form those trusted partnerships, as Melinda just said, and make sure you get out that reliable communication and you're there to answer and help anyone along the way who may need some extra assistance.
Wonderful. Somebody slip a question in? No, I guess not. Okay. Well, let me, on behalf of NANASP, say thank everybody for joining. I want to especially shout out Laura Borth and her work on preparing, getting this webinar put together, and also our colleague Chloe Lloyd. And remember, NANASP is a resource too. Okay. Let's not forget that we're available to help. We want to gather information. We want to continue our advocacy. We want to make sure Medicare open enrollment goes well and that we're making the right decisions with the right kind of information. And we'll stand by and be available to anyone who wants to check with us on what we're hearing and what we can share. So with that, we're happy to give you back 5 minutes of your day. And we hope that you enjoyed this webinar, and thank you very much.
Thanks, everyone.